Okay. Yep.
Also, just make sure if everyone can, if you also have a webinar webcam that can be presented for. And welcome everyone to the ECPM pre-Congress course first phase webinar. And from here, I would like to welcome Professor Seton, who is a big part of the ECPM Congress, and we'll be reviewing the ECPM pre-Congress courses setting 1 through 4. Professor Seton?
Hello, everybody. I'm Irene Cetin. I'm talking from Milan, from the Hospital Luigi Sacco in Milan. And I'm here as head of the Educational Committee of the European Association of Perinatal Medicine. So first of all, this committee is made of a number of people, and we have discussed many times already, starting from more than 1 year ago, which topics would be most interesting and important from an educational point of view. Those topics that would be important to know from a practical point of view or from guidelines point of view with different levels, so from basic to more advanced, but those topics that need to have maybe less people and a more a situation where people can interact with the teachers and have a relationship, a direct relationship with the teachers. And so we discuss these topics a lot, both from an obstetric and neonatal and the perinatal point of view. Some topics are more obstetric, some are more neonatal, but we try to keep this perinatal idea that it's important that obstetricians can learn more about the neonatal aspects, and neonatologists can learn more about what happens before. So after all the discussions, we came up with a number of topics, and I hope it was a fruitful production. I hope people will appreciate these topics. And today we are going to present the first 4 of these pre-Congress courses. And they are, of course, you found them. You can find them on the website. They are starting from neonatal stabilization and resuscitation. This is a pre-course that will have practical aspects with mannequins in order to be able to learn about the new guidelines for neonatal stabilization and resuscitation, but also to practice the practical aspects of this core, of this topic. And you will hear more about this pre-course from Dr. Liliana from Slovenia. And then there is going to be a course, a pre-course on maternal and neonatal transport. This is a pretty interesting topic because across Europe there are still many divergences about when to transport a fetus in utero or a neonate, which are the indications and the contraindications to transport in utero, or when it's better, and then to decide instead when to transport a neonate, and what are the requirements for transport in order not to make any, not to put in danger either the fetus or the neonate or even the mother. And so, and you will hear more about this course as well. Then there is a very intense course, pre-course 3. It's divided in 2 parts, morning and afternoon, with 2 different levels of expertise, where this really hot topic now in obstetrics of maternal cardiovascular function and maternal hemodynamics, and Professor Wilfried Giselaars is already ready to tell you more about this course, I will not tell you a lot about this. And then course 4, pre-course 4, is also divided in 2 parts, morning and afternoon. And the first part is very basic but very practical with mannequins about basic obstetric maneuvers, and Dr. Patrizia Antonazzo and also Dr. Saita will tell you more. And the final course we will talk about today is the pre-course for afternoon that is organized by the ECPM working group on intrapartum fetal monitoring, and it's going to be presented by Professor Diogo Aires dos Campos. And this is on a very important topic for us who work in the delivery room. And I think that I will start so we're going to go now reverse. So we start from the end. I will ask Diogo to come on now and tell you more about this exciting course. So please, Diogo, if you are still online, because I cannot see you, but I think you are online, so please take the lead now.
I am, Irene. Thank you. Thank you for that introduction. So I'm going to speak about the second part of the fourth course, which is in the afternoon. It's the Figo Intrapartum Fetal Monitoring course. And actually I'm very excited because it will be the first time that we are going to present such a course in international meetings after the approval of the new 2015 Figo guidelines on intrapartum fetal monitoring in October last year. Just a little bit of a background, I'm sure people will know that there are several guidelines for fetal monitoring that have been used, and they are not all the same, and some are proposed by the American College and some by NICE and the Royal College, and many countries have their own guidelines, and this I think has created some confusion. So Figo three years ago decided to take the initiative to try to achieve some consensus in this complex topic. So the 50 people were contacted from all over the world and came up with the new Figo guidelines that, as I said, were presented at the Figo Congress in Vancouver in October and have been are available online at the Figo website. They've already been approved by the ECPM, the association that is promoting this Congress, and as well as by EBCOG and by the American College of Obstetrics and Gynecology. So what we're going to do is we've been preparing a PowerPoint presentation that will be available for everybody, but we are actually at the moment we are going to see how this works in some pre-Congress courses, such as the one that we'll have in Maastricht. We're going to have 4 sessions, one on the physiology of fetal oxygenation and the main aim of fetal monitoring, which I think is crucial for the understanding of the whole concept of fetal monitoring and management. There will be a session on cardiotocography, which is sort of the central aspect of fetal monitoring in labor. There will be a session on intermittent auscultation, and finally a session on adjunctive technology. So these are sort of 30 minutes, 40 minutes presentations on these aspects, which are the central aspects of the Figo guidelines. They will be presented by members of the ECPM study group on intrapartum fetal monitoring. All of them were involved, all the people presenting were involved in the development of the guidelines. And finally, there will be some time for case discussions that we hope will be interesting as a way of putting theory into practice and applying some of the concepts of the new guidelines into actual cases. So hopefully it should constitute an exciting new way of looking at intrapartum fetal monitoring, and it should help people in their everyday clinical practice in the labor ward.
Okay. Okay, Diogo. So I don't know if there are, I'm not sure if there are questions about this, but. Wilfred, what are you telling me? There are questions?
Yes, now, you can hear me now?
Yes?
Yes, we can.
Okay, fine. Yes, well, I happened to be at a meeting last week on, and there was a discussion about the, how to introduce the new Figo criteria for interpretation of CTG, and whether this would trouble further research on the application of ST analysis into clinical practice. Because at the moment there are 5 RCTs on STAN analysis, and well, the Figo criteria are a bit different now from the STAN criteria, and there was a discussion whether the introduction of these new criteria would trouble comparison of new studies with the former ones.
Yeah. Yes. Thanks for that question, Wilfred. It doesn't have a very simple answer. That we're aware that the majority of the world does not use STAN, and we needed to have a solution that will be useful for the majority of the world. And we are aware that the STAN classification, which was allegedly based on the old Figo classification, I have serious doubts that that is the case, because the old Figo classification had 3 categories, which is normal, suspicious, and pathological, and the STAN has 4, so there's a major dissentiment right from the start. But we are aware that going back to the 3-tier classification, which is what is used also by the Americans and the Royal College, etc., it will create problems for STAN analysis, and it might put into question all the results of the previous randomized controlled trials. Yes, that is obviously a problem. The way to deal with that is something that will be, I'm sure, in the discussion over the next months, if not years. And we've already been discussing with the company that commercializes the system, which how to handle it. At the moment, no decisions have been taken, so it's still open to interpretation. But yeah, it's a problem that we have to deal with.
It will probably be a matter of discussion at the course, so it's an interesting topic indeed. Yes, fine. Okay, thanks.
Very good, thanks.
Thank you, Diogo. I think it's going to be really exciting. The only problem is that I will have to be at another pre-congress, so I will not be able to be there. It's too many good topics. Yes. Okay. But okay.
Irene,
yeah.
Irene, I was wondering if you would like to ask who are the people attending. I don't see a list of their names, but maybe it might be interesting to see who is attending.
Yeah, I see there are some people attending, so maybe if somebody wants to volunteer and say who they are.
My name is Sylvie Keeselaars from Belgium.
Okay, who else is there?
Hello, my name is Emanuela Martini. I'm connected from Italy.
Oh, Emanuela, you are from which city?
Milan.
Ah, okay, so we're close actually. Are you planning to come to the Congress?
I'm part of MCA Scientific Events, so I'll be there.
Okay. Who else wants to tell who is connected?
I am connected. I'm Alfredo Cunha from Rio de Janeiro, Brazil.
Oh, wow. Are you coming? And if you are coming, which pre-congress are you planning to attend?
Not yet. I've not decided yet.
Okay.
I'll be at the Congress, sure.
Okay, good. So I will now pass the lead to the, we are going backwards, so I will ask Patrizio Antonazzo if he's connected, I think yes, to tell you about pre-congress 4 in the morning, and it's about basic obstetric maneuver. So please, Patrizio.
Yes, thank you, Irene. I introduce myself. My name is Patrizio Antonazzo. I'm working with Professor Cetin, and now I coordinate the delivery room group at Sacco Hospital in Milano. In the last few years, I participated the working table about the risk in delivery room organized by the Lombardy region. And in this work, in our work, we have spread and implemented the concept of practice to improve care in a delivery room. So we organize a course based on these endpoints. The topics will include shoulder dystocia, instrumental delivery, and breech delivery. Therefore, the course is a simulation of a real case. So we need doctors, nurse, midwife, and patients. We simulate an emergency. Then we analyze the management, and we develop the issue of the theory by highlighting the errors. So this is our idea.
So how many people would you like to have in your course?
25.
So it's going to be, so you're going to be how many teachers there? You and who else is going to?
3 teachers, 3 Tata from London, and Bianca Masturso from Torino.
I think also Diogo is going to join you.
Yes.
Diogo, you're going to be there, right? Yeah, so actually you're going to be 4, and so people, I think the nice part about this course is really that people will be able to practice in a not a 1-to-1, but a 5-to-1, 5 people that will attend, 5 attendees with 1 teacher for them.
For each item, yes, yes.
Yeah, yeah. So I think that you will have probably people that will be very much interested in this, because I think particularly young people need to have practical courses to learn how to be in the delivery room. Okay. Any comments about this course? Okay, so if there are no more comments, I think that we can now go to Pre-Congress 3, and Wilfred Giselaars from, you're from Maastricht, right, Wilfred?
Near Maastricht. I'm actually from Genk, and this is about 30 kilometers from Maastricht, but it's very close.
Okay.
So yeah.
Okay, but
right.
you're playing at home anyway. You're
actually,
it's your Congress,
yes,
right?
Actually, we are,
okay.
Yes. Fine,
okay.
thank you. Thank you for the introduction. Good afternoon, everybody. So the course number 3 is basically on maternal hemodynamics, and which is split in 2 parts. Because it is indeed, as Professor Cetin already mentioned, something growing since a few years now, and well, actually we're building up from fundamental physiology, methodology to pathology, and this is how this course is been constructed. So the morning session basically is on the physiology of the different parts of the cardiovascular tree, so the heart, the arteries and the veins, and then about the technologies that can be used. Most of them are non-invasive now, that can be used to evaluate these functions. And the lectures are given by people who are actually experts in the field, like Herbert Valencies. He is already quite active in cardiac function of pregnant mothers, and well, he's doing the part on the physiology of heart and arteries, Then Ian Wilkinson of Cambridge is doing, they are having quite some experience on the assessment of the arteries, and John Cockcroft from Wales, from Cardiff in Wales, he is quite experienced in the assessment of cardiac output. They also did a very nice review paper recently on this topic. And then after the break there will be something by myself on the physiology of the venous compartment, and this is in combination with Mark Spanderman from Maastricht, who is doing the part on plasma volume. And then Christophe Lies has started a quite large study now recently on the early gestational cardiovascular changes, so he's a bit making an overview of this course. Well, the first session has been labeled a medium level course because it is it is directed to well, both specialists on in obstetrics, perinatology, cardiology, but also on midwives and trainees, junior doctors. Well, and the afternoon session then is actually on the pathology, which and the pathophysiology observations that can be done in pathologic pregnancies using the technologies that have been discussed in the morning session. So first of all, there will be Enrico Ferrazzi from Milano, is from your hospital, I think, Irene, isn't he?
Yes, we are in two different hospitals, but it's the same university. It's the same university, yeah.
All right, okay.
Yeah.
So Enrico is presenting his data on well, about the evidence actually on the existence of two phenotypes of preeclampsia. Herbert Valencies then is doing a topic on the changes, the cardiac changes in gestational hypertensive disease, which are different from the normal pregnancies. And I'm doing the same thing on the venous compartment, also the comparison between normal pregnancies and the abnormal ones. Asma Khalil from London, she is doing then the arterial dysfunction and at 12 weeks, and whether we can use this for screening. And then there will be Pesky telling about the cardiac diastolic dysfunction and fetal growth. And then finally there will be a summary again by Hans Duvekot from Rotterdam, who is linking the observations of the abnormal dysfunction, the cardiovascular system during pregnancy, with the long-term disease at later age. So in fact these courses are both courses are a bit the summary of the two congresses that have been done by the Maternal Hemodynamics group. One was in Hassel 2 years ago, and the next one will be in May in Rome. So these are a fundamental summary actually of these congresses. Well, that's it basically.
Yeah, well, it sounds really exciting and very full, really. No, I think it's really interesting. I think it's very important. It's a very important new topic, definitely, and not new, but I mean, it has a new interest now in the last year. Yeah. I think it has become very relevant. It's, you know, we sort of go from the mother to the placenta to the fetus, then we sort of, I think it's important for people to come to your course because it's really a topic that has had new research in the last years, and there are some new information that can be utilized also in clinical practice. Do you think people will learn some practical information also, or it's more to be, you know, to become more aware of this field? I mean, do you think it's something people will learn something that they can go back and apply directly, or it's more for people that want to do some research on this topic and so on?
I think the main goal of this course is actually to introduce these new technologies to perinatologists and obstetricians, because, well, this is what I hear in our hospital, that actually they do not really expect an obstetrician to be interested in the cardiovascular system, and that has always been considered part of the cardiologics field or the intensivists area. Now obstetricians can easily perform these assessments as well, because there now are technologies which are very simple to use, which are not too expensive, and that can be introduced everywhere. And this presenting to everybody is actually the main goal of the course.
Let me ask you something. This is really because I don't know really, so I want to ask you. So are there already guidelines that incorporate these techniques? You know what I mean? You know, like for high-risk pregnancies, are they already? Do they have already protocols that tell you exactly when to apply them, or is it's something that needs yet to be developed as guidelines?
This is something indeed that will be developed within the next few years, I guess, because now we only have the information needed to produce these kind of guidelines. But there will be soon, I guess. I remember the last meeting we had with our hemodynamics group, where already some proposals were made to establish guidelines, for instance, the measurements of total vascular resistance in early pregnancy, the measurement of cardiac output in early, because they are so fundamental to its outcome of the pregnancy, that and they are so simple to measure that it's a shame not to do it actually. But these guidelines are to be produced.
Yeah. One of the issues, of course, is if you find that there is something abnormal. Now I'm making it very simple. I know that it's not so simple, but then so if this would become a screening technique, then what do you do next?
Yes, that's indeed the point. So we don't have any medication to offer. We don't have any particular treatment to cure the disease. That doesn't exist. But what we are doing now in our department is we can actually discriminate the low risks from the high risks, and actually it's becoming a fundamental part of the daily practice now, that those who are labeled as low risk actually go to midwifery care. And this is basically 80% of the pregnant women, and the 20% that are considered as at high risk, they are now being put in a system of remote monitoring. So. So this is a bit, we have a discrimination between the ones that are having an intensive follow-up and those who have just a normal basic follow-up.
Yeah, okay. So it's really a way to know better, to find better ways to discriminate pregnancies that are indeed at risk, so that we can monitor them in a better way. And, and indeed reduce the controls in the low risk, so that they are more actually physiologic, and they can live more happily their pregnancy maybe. But,
well, that's right,
Okay.
And we have already quite some data which show that this approach actually leads to the same results as we had before, but with lower need for outpatient visit and with lower need for hospital admission. So this is, well, again.
And do you think that this decreases also the risk once these patients, if they are in the low risk, do they are also at lower risk in the delivery room?
Well, the other complications, of course, can happen. And this is fundamentally on blood pressure and fetal growth. But yeah, of course, we cannot tell anything about preterm contractions or breech delivery or so whatever. But on the cardiovascular system, yes, they mostly remain low risk indeed. Yes.
Okay. Okay. Okay, so thank you, Wilfried, and I don't know if there are questions for Wilfried or from any of the people who are connected, also from the faculty. Okay, after then, thank you again, and we'll proceed further with pre-course 2, that is on maternal and neonatal transport, and I'm actually coordinating this course together with Magdalena Rutkowska from Poland, and I know she's online.
Yes.
And so, okay, hello Magdalena. So
hello.
I think I have spoken already a lot, so you can talk about this course.
Yes, this course is two parts. One part is the problem of maternal transport on the levels of maternal care and indication and contraindication for acute maternal transport. And the second part is the part for neonate transport, and is the problem of the transport of term neonate and the preterm. In term neonate, we discussed the indication for acute transport and also for congenital and fetal malformation. And after we discussed the transfer for preterm baby, especially with the baby with RDS syndrome, and we discussed the protection of the lung. And the second part is to discuss with the transport, transport of asphyxial baby, and the problem of transport for baby with very long distance, and we discussed the transport by aeroplane. It is the speakers of for 5 or 6
countries, maybe.
Yes, 6 countries, and from our country, from Poland, is 2 people. Professor Mazela is a specialist for the problem of the lung, and he's specialist also for the problem of the surfactant and the protection the lung by the surfactant will be given by inhalation. So perhaps you discuss also this problem.
Actually, it's 5 countries, I realized. It's also Denmark.
Poland, Russia, Denmark, and Netherlands. Yes.
Yeah. So I think one interesting part of this course will also be to discuss different organization procedures in different countries across Europe, because probably the regulations are different. And for example, in my region, we have a very good neonatal transport that is very well organized, but we don't have really a specific organization for maternal transport, for in utero transport. So we are developing these guidelines now, and actually Patrizia Vergani, who is going to be speaking as first speaker, she's really becoming very expert on this. They are developing a computerized system for in utero transport, for back transport, and I think it's very interesting how all these things connect, and you need to really evaluate very carefully whether it's safe to transport a mother. We had a case recently when a mother was transported, and she was 28 weeks, and she went to a hospital that did not have the neonatal intensive care unit, and she had signs of severe preeclampsia developing quite acutely. So they transported her to another hospital with the neonatal intensive care, and it took 30 minutes for the mother to arrive to the other hospital. And when she arrived at the other hospital, she had convulsions. And it was just, lucky that it was just a matter of minutes, but then they were able to stabilize her and so on. So we are now discussing whether it would have been safer to keep the mother and stabilize her in the first hospital, and then decide whether to deliver the baby there, having the neonatal transport ready for transport of the neonate, because sometimes you have to evaluate many things at the same time. And also other things we are discussing a lot is who should be going on the ambulance. With this case, for example, you needed the anesthesiologist, the obstetrician, the neonatologist. I mean, it was really complicated. So I think these things need to be very well organized. We need to have guidelines that tell people how to behave. But when you're in an emergency, you need to know how to work with set rules, because otherwise it can be difficult, I think.
Thank you.
So Magdalena, I don't know if there are questions or comments for the other people that are connected. I think this workshop really wants to be a perinatal course. And we really look forward to have participants that are obstetricians and neonatologists, because we need to discuss together these issues. We really need to discuss them together. So I really hope to have people coming that want to participate, to learn, but also to have a confrontation with us, telling us also the problems that go on in the different countries.
I think also that we discuss about the place of corticosteroids in the transport, after the transport, or it is better to give the corticosteroids before, etc. It's a very important place for us for discussion with gynecology.
Yes, sure, yeah, sure, definitely. Well, I'm glad we are going to do this, and I think the European Association of Perinatal Medicine should develop a working group on this that develops these guidelines. Also, at the end of the course, we should be meeting again in order to write some of the conclusions from this group of people. So I really look forward to this. Okay, so now last but not least, we are coming to the pre-course 1. Pre-course 1 is the one on neonatal stabilization and resuscitation. And I think Liliana, you're still there. You are the last one, but you have an important course. Indeed, we call it course 1, pre-course 1, so this tells us that it's very important, but you can tell us more about it. I hope, Liliana, you're there. I cannot hear you, but... Do you know if Dr. Kornhauser is connected?
It seems that she is self-muted.
Ah, okay.
Yes.
Liliana, you should probably, I don't know if you are hearing me. Okay, otherwise we can say something. I can say something about it.
Liliana, if you can see a microphone up on top in the dashboard, you should see there's a red microphone. If you click that red microphone, it should turn green and will allow you to speak, if you're able to.
Magdalena, do you want to talk about this course? Because you are a neonatologist, so maybe you want to, if you can see it on the website. Remember, we discussed this one. Otherwise, I can say something, but...
also another option, Liliana, if you just to make sure that you're hearing us, if you want to write something in the chat, which is on the dashboard.
A moment. Just a moment.
Magdalena?
Yes, I would like to.
Okay, you can say something, I'm sure.
Just a second.
Magdalena, are you connect? Are you going to speak?
Yes.
My name is Marzena Zahara. I'm a doctor working with Magdalena. So I'm going to tell something about this pre-Congress course 1, neonatal stabilization and resuscitation. I'm actually presenting the neonatal transport in congenital malformations, which is very important. But regarding the neonatal stabilization, we want to probably we should concentrate on neonatal resuscitation and overview of a history and recent advances. We are going to concentrate on fetal physiology and pathophysiological changes, aspect of fetal and neonatal resuscitation. I think we have to mention in utero resuscitation and stabilization, and concept of minimal handling in the delivery of really little babies, I mean premature babies, which is very important. We have to be very delicate. Next problem will be ex utero intrapartum treatment. So exit procedure, which is also possible. One of the colleagues will speak about oxygen in the delivery room, which is very recently, it's very problematic issue, because it turns out that oxygen may be very dangerous for the babies. And stabilization of preterm infants with RDS, of course, and neonatal assessment in delivery room, new test, new APGAR scores, and of course, which is very important, ethical dilemmas in fetal neonatal resuscitation, which come over to everyday life in our life. And we have people from different countries. I can't count how many. I think five nations will be presented. Okay.
Yeah.
So I think this short view.
Yeah, I think one important reason why we decided to have this course, this was one of the first courses that was decided. If I'm correct, there were new guidelines that recently came out, right? Is that correct?
Yes, with using oxygen and not oxygen, and with CPAP using on delivery room.
Okay, so
there is two guidelines in this moment. The first one is the guidelines Europe guidelines in October 15, and the second one is the guidelines for people with RDS syndrome with in September 14. So, in my opinion, it will be very interesting to discuss the changes in this protocol and two guidelines, American and European, because it isn't the same.
Mm-hmm. I think there are. I mean, I'm not so expert in this field, of course, but I heard some presentations recently. And I heard there are also some changes in some basic things, like the time that is considered now to the time that you need to make 1 minute or 2 minutes to do a number of maneuvers has changed. If I'm correct now, I'm not sure of what was the change, but then also the way you manage the temperature of the baby is, are these anche simple maneuvers, I think, that were somehow, the rules have changed a little. Is that correct, Magdalena?
Yes, yes, of course. Yes, of course, and it is also discussed for the end of resuscitation about 10 minutes, and we discuss it is to continue or not continue. It is very important and ethical problem. How and when, why stopped the resuscitation?
Okay. Okay. So, are there questions from the participants? Wilfred, please.
Yeah. Now, a discussion which was quite hot in Belgium recently was about when to, well, at what gestational age neonatal resuscitation should be initiated or abstained, and I'm talking about the age of viability now, so between 24-26 weeks. This is also something that is in this course of our...
Well, I think the ethical dilemmas, the last presentation is the last. The last speaker will discuss this, and I think the whole course will probably deal a little about this. But I think it's very different from country to country.
Yes, exactly. It is the green zone. This is a green zone for country to country, for 22, for 25 weeks of gestation. So it is a very interesting dilemma in this moment in all over the Europe and in America also.
Yeah. Okay. So I think we we told people that were listening a lot of potential interesting topics, and so I hope to have touched the most important things. I don't know if there are other comments from the other people who are online, or otherwise I think we can probably we can finish.
Well, I would like to congratulate everybody, because I think all the pre-Congress courses that have been presented here today are all very exciting and very interesting. So I think that this is a very good introduction for the Congress. So congratulations to everybody.
Magdalena, do you want to say something to finish?
No, thanks a lot. I think that the subject is very interesting, and I think that the time is not. You have not much time to discuss for all the problems, in my opinion.
Yeah, yeah. Patrizio, if you are still there. Or Diogo?
I want to thank you.
Who's speaking?
Yes. Okay. I want to thank for this participation.
Okay. Great.
Yeah.
Well,
And, Irene, just to say that I'm really looking forward to participating not only in the Figo Intrapartum Fetal Monitoring course, but also in Patrizio's course with the simulators. And I think it's the only thing I regret is not having the opportunity of going to the other courses, because after listening to these presentations, they seem to be very exciting. So looking forward to the event in Maastricht.
okay. Thank you to everybody, and have a good day, and see you in Maastricht in June 15, 2016.
Bye. Okay.
Ciao, 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 ciao.
Thank you very much.
Bye-bye.
Thank you.
Thank you.
Hello.